Okay, the goal of this video is to help you get started on treating your stress urinary incontinence, leaking with coughing, sneezing, laughing, and exercise. There are procedures and surgeries that can help with this type of leaking, but I'm not going to focus on them. I'm just going to focus on what you can do at home. So, for many women, pelvic floor strengthening will treat their stress urinary incontinence. And this is usually the first thing that we recommend. But the pelvic floor muscles are a little bit of a mystery to many women. So, these muscles go from one hip to the other hip and from your pubic bone to your tailbone. And they're shaped like a bowl and they hold up all of your pelvic organs. These muscles are also connected to your sphincter, so those muscles that hold poop and pee in. And when you strengthen them, you're also strengthening how tightly those sphincters close. To improve the strength of these muscles, you need to be able to contract your pelvic floor. You need to be able to do a Kegel contraction correctly, and some women have trouble with this. So if you're not sure that you're doing it correctly, you can check with your provider or a pelvic floor physical therapist. So, when we talk about pelvic floor strengthening, there is good data that working with a pelvic floor physical therapist will help about 70% of women. And so we really consider this to be the gold standard. And a lot of that is because we've really done the most research on strengthening with a pelvic floor physical therapist. But there's more and more data coming out about doing strengthening on your own, so without a pelvic floor physical therapist. And this data tells us that doing it on your own can work as well if, and this is a big if you can do a pelvic floor contraction correctly, and two, if you continue to do the exercises for 3 to 6 months. So it takes 3 to 6 months of pelvic floor strengthening before you see a change in your symptoms. And this is important to remember. Often your strength will improve before the symptoms get better. And so you really need to stay at it and stay motivated. And that can be really difficult when you're doing something over such a long period of time and not necessarily seeing the benefits of your effort. And I think that's one of the reasons that a pelvic floor physical therapist helps because they help you stay motivated. But let's review some of the ways that you can strengthen your pelvic floor on your own. So, one, you can do Kegel exercises on your own. That definitely works. You can get vaginal weights. So, vaginal weights actually get inserted in the vagina and they provide a little bit of biofeedback, and you can often feel those muscles working a little bit better than if you're doing the exercises without a weight. You could get a peri-trainer. So, a peri-trainer is a device with a vaginal insert. It measures the pressure that the muscles are generating. And the peri-trainers give you exercise routines to do on your own. They're often connected to a smartphone. They will also monitor your progress so you can see how much stronger you're getting. And the routines will often get harder over time as you get stronger. So, for many women, a peri-trainer can be very helpful. There are lots of different peri-trainers out there on the market. The price differential is quite different. Not one has been shown to be better than another. So you should really buy the one that appeals to you. Some are more game oriented. The inserts are different. So you should buy the one that is the most, that appeals to you the most, and the one that is on sale is what I would say. You can also work out with an athletic trainer or with an online PT. There are a lot of different online resources right now and athletic trainers in the area that can help you strengthen your pelvic floor. But they're not assessing your muscles directly. And so you have to be able to do exercises on your own. And then physical therapy, once again, is the gold standard here. Many insurances will allow you to go to PT without a referral. And I've attached a provider finder at the end of this video, which you could use to find a physical therapist if that is helpful for you. Once you have a strong pelvic floor, there is one technique that is recommended by physical therapy. So the best technique, and that is called the knack. You can think of it as kind of squeezing before you sneeze. And in this technique, you squeeze your pelvic floor. So you do the contraction before you do the activity that makes you leak. So you could squeeze your muscles before you jump or laugh, for example. And then over time, your body learns to do this more reflexively, which helps minimize leaking, especially as your muscles get stronger. This technique has been well studied and it does a great job of minimizing or eliminating stress incontinence. And once again, the stronger your muscles, the better it works. So I'm going to move away from pelvic floor strengthening and talk about a couple of different devices that can help. So one, there's a urethral seal, and this is something that you actually place on the urethra, which is the opening that leads into the bladder, and that will stop leaking with activity. You can't empty your bladder with it in place, so you have to remove it. And then there's a pessary. So a pessary is a vaginal insert. You put it in the vagina, you take it out. It puts a little bit of pressure on the urethra, which is the tube that leads from the bladder to the outside. And this minimizes stress incontinence. So there are some pessaries that you get from a physician and we fit you for the pessary, but there are also some that don't require a fitting appointment and some that are available over the counter. So over-the-counter pessaries include the Impressa pessary and the Revive. The Uresta is a pessary that you need a prescription for, but it doesn't require a fitting appointment. So you may not be particularly excited about the idea of pelvic floor strengthening. But the last thing that I just wanted to say about pelvic floor strengthening is that even if this is not the entire answer for you, women who have a strong pelvic floor always have better outcomes with interventions like surgery. So there is good reason for you to focus on this at this point in time. And if it makes you better and removes the issue, and that's all you need to do, then that's a beautiful thing.